All right, so you're here because you love getting a good grasp on something new, something interesting, maybe something a little off the beaten path, right? But without drowning in a sea of information, right?
Right.
You want that light bulb moment, the aha,
Mm.
where it all suddenly clicks into place. And honestly, that's what we're all about here, too. And
Absolutely.
today we're going deep. We're diving into a truly unique document from a fascinating time and place in history.
Yeah, we're taking a deep dive, a real deep dive, into this book called A Barefoot Doctor's Manual. It first appeared in the U.S. back in 1974. And this isn't some, dry theoretical textbook.
Right.
This is like a hands-on field guide. It was used to train community health workers, these barefoot doctors in rural China, specifically Hunan province.
Barefoot doctors. I love that. It really sets the scene, doesn't it? So this manual was their Bible, their go-to for everything.
It was their essential toolkit. Imagine one book. It covers something like 197 common illnesses, the kind of stuff they'd see day in and day out.
But
Then, on top of that, it describes over 500 different herbs. And not just the names, there are 338 illustrations to help with identification.
wow.
And then, to top it all off, hundreds of tried and true remedies, all focused on what actually worked, what people could get their hands on right there in their communities, and what wouldn't cost a fortune. Practical, accessible healthcare.
That's incredible. So much knowledge in one place. But thinking about the US in the mid-70s, that was a totally different world, medically speaking. So how did this manual even end up here?
You're right. Back then, traditional Chinese medicine, things like herbal remedies and acupuncture, were just starting to trickle into American awareness.
Yeah.
There was a lot of curiosity. People want to understand these ancient practices, these traditions that had been around for centuries in China. Was there something to them? Could they work here? Research was really in its early stages.
And there were some pretty big roadblocks, right? Especially when it came to things like regulations and what was considered acceptable medical practice.
Oh, absolutely. In fact, the foreword of the manual even mentions the U.S. Federal Food, Drug, and Cosmetic Act.
Right.
Back then, there was this huge focus on proving the safety and effectiveness of medical devices, especially acupuncture needles.
Okay.
The FDA wanted evidence, scientific proof, clear instructions for how to use them.
Makes sense.
But because that kind of research was still in its infancy, acupuncture was mostly limited to research settings. It really highlights this stark contrast. You have this long, rich history of acupuncture in China, and then this very cautious, evidence-based approach here in the U.S.
So just to be clear, we're not here to say one system is better than the other. What we're trying to do is explore this different approach, this different way of thinking about health and healing.
Exactly. Our mission here, in this deep dive, is to unpack the incredible amount of medical knowledge and the range of practices that are laid out in this one document. It's a window into a whole different healthcare system, different foundations, different priorities, different methods. It's about seeing your body, your health, and what causes disease in a new light.
I like that. So let's crack open this manual, figuratively speaking.
Hmm?
What did it teach about the human body? Like the basics, the layout, how it all works?
It starts with, well, Anatomy 101, just like any medical textbook. Figure 1-1 is this basic diagram of the external parts of the body. Your head, neck, shoulders, arms, legs, the usual suspects. And then figure 1-1-1 takes you inside.
Okay.
It shows the key internal organs. Lungs for breathing, the heart pumping away, the liver, the stomach, the intestines for digestion, the bladder. It's laying out that fundamental map of the body.
And it dives into the senses too, right?
It does. For the eyes, figure 1-1-2 shows a frontal view, highlighting structures like the tear ducts. Those keep your eyes lubricated, right? And then there's the conjunctiva. You can think of it as this clear, protective layer over the white part of your eye and the inside of your eyelids. It's the reason why your eyes get all red and irritated when you're tired or if you have allergies.
Makes sense. What about the ears? I remember there being some interesting details about those.
Yeah, figure 1-1-3 illustrates the ear's anatomy, emphasizing its role in both hearing and balance. What's fascinating is it points out several acupuncture points right on the outer ear, the pinna.
Oh, interesting.
And the earlobe, that soft, dangly part, that was mentioned as a good spot for taking blood samples.
You don't usually think of your ear as a place for treatment or diagnosis, so any other sensory organs get a close-up.
It also covers the nasopharynx and larynx. That's the area at the back of your nose and throat, leading down to your voice box. That's figure 1-1-4. It explains the paranasal sinuses. Those are those air-filled cavities in your skull that connect to your nasal passages.
Yeah.
And because they're lined with the same kind of tissue as your respiratory system, well, they can easily get infected when you have a cold or the flu.
Right. And then there's the tongue. which I understand plays a big role in how traditional practitioners assess someone's health.
Oh, absolutely. The manual describes the tongue as this powerful muscle, crucial for taste, which helps get your digestive juices flowing. But it also highlights its role in chewing, swallowing, even speech. It specifically mentions the frenum linguae, that little fold of skin under your tongue, and how a short one can affect speech clarity.
Interesting. So moving down from the head, the manual also delves into the spinal cord and the whole network of nerves, right?
It does. Explains how the spinal cord protected inside the spinal column is divided into segments. And it makes this really crucial point. It says the pathways connecting your brain to pretty much every other part of your body, they all run through the spinal cord.
Right.
So any injury to the spinal cord can have massive effects on your ability to move and feel. It also talks about the 31 pairs of spinal nerves branching out, and the layers that protect your brain and spinal cord with the cerebrospinal fluid in between, acting as a cushion and transporting essential substances. It even mentions its importance in diagnostics if doctors need to analyze it.
And wasn't there something about newborns, something specific to them?
Yeah, this is interesting. There's this mention of the soft spots on a baby's head, the fontanelles.
Right.
Apparently the locals call them fengmen, which translates to the gate of energy.
Gate of energy.
The manual says that if a baby develops encephalitis, inflammation of the brain, before these soft spots close up, the increased pressure from the cerebrospinal fluid can actually cause the forehead to bulge. It's this fascinating blend of traditional observation and basic anatomy.
That's really interesting. The manual also touches on the endocrine system, something we have a much deeper understanding of today. What was their perspective on it?
Figure 141 shows the main endocrine glands, your adrenal glands sitting on top of your kidneys, the pituitary gland, kind of the master controller, the thyroid in your neck, the parathyroid glands, the pancreas, and the sex glands. The manual correctly identifies that these glands produce these vital hormones that go straight into your bloodstream, traveling all over your body. And it emphasizes their role, working with your nervous system, in coordinating all your body's activities, influencing things like metabolism and growth. It even acknowledges that if these glands aren't working right, it can lead to illness.
And what about the heart, the cardiovascular system? The heart and how blood flows through the body.
Well, figure 161 gives you this front-on view of the heart showing its 4 chambers, the atria and the ventricles, and those big blood vessels like the aorta, which carries oxygen-rich blood out to the body, and the pulmonary artery, which goes to the lungs. It explains how the blood, both oxygen-rich and oxygen-poor, circulates through the heart, and how the left ventricle, this powerful pump, sends that oxygenated blood out to nourish your entire body.
Okay, so we don't really think about tissue fluid much in our day-to-day lives, but it's actually super important for how our bodies function. How did the manual address this?
It explains that normally your body keeps this delicate balance between creating tissue fluid and reabsorbing it. It's crucial.
Right.
But it points out that if you have certain diseases and your body produces too much fluid, or if it can't drain it away properly, that's when you get edema. That's swelling in your tissues.
Right.
On the flip side, it describes how a big loss of tissue fluid, or the fluid in your blood, that causes dehydration.
Right.
And, the telltale signs. Wrinkly skin that doesn't spring back, maybe you feel dizzy, weak. And if it gets really severe, it can cause some serious problems with your circulation and your body's acid-base balance.
So the manual covers quite a bit of ground when it comes to how the body works. But before we move on, what did it say about the female reproductive system?
Figure 110.2 shows the internal female reproductive organs. You have the vagina, the uterus, where a baby develops. It even highlights its 3 layers, the outer serous coat, the muscular layer, and the inner endometrium. Then there's the cervix, connecting the uterus to the vagina, and the fallopian tubes.
Okay.
It describes the uterus as being essential for both menstruation and pregnancy, obviously, and its connection to the outside world through the cervix.
Right.
It also points out the fundus, the upper part of the uterus where the fallopian tubes begin.
Okay, so that's a pretty solid grounding in their understanding of the physical body. Now, the manual also has a section specifically about children. What kind of physiological differences did they point out for kids under 10?
Right. This section really dives into how the bodies of kids, younger individuals, function differently. When it comes to the heart, the manual mentions the possibility of congenital issues, problems present at birth. Sometimes, certain blood vessel connections that are normal in the womb, they don't close properly after birth, and that can cause problems. It also notes at the point where you can feel the heartbeat strongest on the chest, the apex beat, that's usually higher and a bit further out from the left nipple line in kids.
Oh, interesting.
And importantly, it points out that kids naturally have a faster heart rate,
Yeah, that makes sense.
ranges from 85 to 140 beats per minute. And the younger the child, the faster it tends to be.
And what about reflexes and those sorts of physical characteristics that might be different in kids?
Okay, well, this is interesting. The manual observes that certain reflexes that would be red flags in adults are actually normal in babies under 2.
Oh,
Things like Koenig's sign, where the knee bends when you flex the neck, and Babinski's sign, where the big toe extends when you stroke the sole of the foot.
yeah.
Those would be worrisome in a sick adult, but they're perfectly normal in babies.
Hmm.
It also notes that kids tend to get cramps easily when they're sick, and that they startle more easily at loud noises, even when they're sound asleep.
And any specific points about their skin and muscles?
Absolutely. It emphasizes how delicate a baby's skin is, how easily it gets injured or infected,
Right.
and it mentions how infants often have a redder complexion and are more prone to fevers,
Mm-hmm.
partly because their sweat glands aren't fully developed until around 6 months,
Oh, okay.
so they have a harder time cooling down. And then it points out that babies under a year, they have more subcutaneous fat, that baby fat, which gives them that chubby look.
Right.
And finally, it notes that muscle development isn't very noticeable in infants because their muscle tissue is still so soft.
It's amazing how they combine those anatomical observations with these specific traits of different age groups. Now, shifting gears a bit, the manual also explores how different organs are connected to each other from a traditional Chinese medicine perspective,
Right.
which is quite different from how we think about it in Western medicine. Can you unpack that for us a bit?
This is where things get really interesting, where you see this fundamentally different approach to how your body works as a whole. The manual outlines these paired relationships between organs and how a problem in one area can manifest in a seemingly unrelated part of the body. For example, it talks about the heart and the small intestine.
Okay.
It suggests that if there's an excess of what they call heart fire, which isn't a literal fire, but more like a concept of too much heat or activity in the heart, this can affect the small intestine,
Okay.
leading to things like blood in the stool or urine.
Wow.
So, you see, it's not just about the individual organ doing its own thing. It's about this interconnectedness, this flow between different parts of the body.
That's a really different way of thinking about those kinds of symptoms. What about the liver? What role did it play in their understanding beyond just filtering toxins?
So the liver, according to the manual, is located under your right ribs, and it has a bunch of key functions beyond just storing and regulating blood. They believed it governed the sinews. Think of those as your muscles, tendons, and ligaments.
Right.
The manual emphasizes that their strength and health depend on getting nourished by the liver's blood. It also directly links the liver to your eyes, saying that they rely on this liver blood for good vision.
Interesting.
And get this, the liver was also seen as crucial for regulating emotions and mental activity.
Wow. Okay, and what about the testes? Do they see their functions as extending beyond just reproduction?
Yes, they did.
Yeah.
The manual explains how issues with the testes can have widespread effects, not just on fertility, but also on growth and development, the ability to reproduce, and even how your body manages fluids. And this could lead to all sorts of seemingly unrelated symptoms, like weakness in your legs, hair loss, ringing in the ears, deafness, a general feeling of being unwell, impotence, even problems with urination and fluid retention.
It's amazing how interconnected they saw everything. And finally, in this section on traditional perspectives, what about the urinary bladder and its linked organ?
Well, the urinary bladder's main job, as they understood it, was to store and expel urine, which is pretty much in line with modern understanding. But they highlighted this paired relationship between the bladder and the kidneys.
Right.
They explained that after body fluids are distributed by the spleen and regulated by the lungs, they get stored in the bladder. And the kidneys were seen as having a role in further processing or aerating these fluids before they're expelled. Again, it's this more interconnected view.
Yeah, a much more holistic view. So the manual also dedicates a big chunk to public health and hygiene, which seems essential for community health workers, especially in a rural setting. What kind of practical advice does it give?
This section is incredibly thorough and practical, really emphasizing prevention.
Yeah.
When it comes to drinking water, boiling is their top recommendation for disinfecting it. And they're specific. They say a full 15 minutes of a rolling boil. They also describe how to purify water using alum, which helps cloudy particles settle to the bottom, and adding a little lime to speed up the process.
Simple but essential stuff.
Absolutely.
What about industrial hygiene? That seems surprisingly forward-thinking for the time.
It really is. The manual lists a bunch of important practices: banning smoking and eating in the workplace, advising against using machine oil to clean hands, warning against inhaling toxic fumes, recommending workers change out of their work clothes after their shift, emphasizing hand washing and showering, and they advocate for using protective gear, like masks and gloves, when handling hazardous materials.
It's like a modern workplace safety guide, almost.
Yeah, pretty much. And they stress the importance of pre-employment health checks and regular checkups for workers exposed to toxins, catching problems early and maybe even changing jobs if needed.
Wow, very proactive. So, beyond the workplace, what kind of advice did it give on preventing everyday accidents and protecting those who might be more vulnerable?
There's a lot of caution about carelessness with farm tools, machinery, vehicles, things that could cause cuts, scrapes, crush injuries.
Mm.
They also warn about venomous bites and the risks of electric shock, especially during storms. And they emphasize seeking prompt care, even for seemingly minor injuries. And importantly, they specifically address the needs of working women during menstruation, throughout pregnancy, when they're ill, and while breastfeeding, suggesting lighter workloads and extra attention to hygiene.
Very thoughtful. Fly and mosquito control are still huge public health concerns in many parts of the world. What methods did they recommend?
For flies, the focus was on eliminating breeding grounds.
Right, makes sense.
Rotting organic matter, feces, garbage, food scraps. They stressed keeping outhouses and septic tanks clean, using lids on waste containers, fencing off animal areas, and regular cleaning. To deal with maggots, they suggested burying compost piles deep to cut off their air supply, pouring cow manure into latrines, even feeding maggots to ducks.
The ducks.
It was a practical solution.
Right.
And they mentioned traditional remedies, too, like using stargrass and clerodendron fungi, which are specific plants.
And what about those pesky disease-carrying mosquitoes?
Right, they acknowledged that mosquitoes could spread malaria and encephalitis.
Yeah.
And because they breathe so fast, early control was key. They talked about getting rid of standing water, using larvicides like oil and DDT.
Although we know now that DDT has some serious downsides.
Right, but back then it was considered a miracle solution. They also recommended using smoke to drive mosquitoes away, burning things like duckweed mixed with realgar, which is a mineral. For grasshoppers, which were also seen as pests and potential disease carriers, the advice was to clean storage areas, use lime to seal cracks, and store food properly.
So, very community-level practical approaches. Now, how did these barefoot doctors actually figure out what was wrong with someone? What were their key methods for diagnosing diseases?
Well, the manual stresses the absolute importance of knowing your patient, really studying their situation,
Okay.
taking a detailed history of their illness, doing a thorough physical exam, gathering as much info as possible, and then using medical principles to understand the root of the problem, how it's progressing, how to diagnose it, treat it, and the likely outcome. So even with a different framework, it's still a systematic approach.
So a structured approach, even if the medical theories they use were different from modern Western biomedicine.
Exactly. They listed their core diagnostic techniques, asking the patient about their symptoms, their medical history, carefully observing their appearance, looking for specific signs. Auscultation, which is listening to sounds within the body.
Often with an ear to the chest, right?
Exactly. Then there's palpation, touching different parts of the body, and percussion, tapping on the body to assess what's underneath. And they stress the importance of putting all that info together, reasoning through it, and of course the importance of ongoing learning and hands-on experience.
It sounds like a very thorough and experience-based approach to diagnosis. What about the specific techniques they use during a physical exam? Did the manual offer any guidance on that?
It describes several things to look and listen for. For instance, it explains what moist rails sound like. Those are those crackling or bubbling noises you hear through a stethoscope when someone breathes.
Oh, right.
And it explains they usually indicate inflammation or fluid in the smaller airways of the lungs. It even categorizes them by loudness: large, medium, and fine rails, each suggesting something slightly different.
What about those bronchial speech sounds I remember reading about?
The manual says that normally when someone speaks, the sound isn't very clear when you listen over their lungs. But if there are solid areas, like in pneumonia where the airspace is filled with fluid, or if cavities form, those speech sounds become much louder and clearer.
Oh, okay.
On the other hand, if there's a blockage in the airways, fluid outside the lung, or conditions like emphysema where the lung tissue loses its elasticity, the speech sounds would be weaker, maybe even absent.
And what about examining the abdomen? Any specific techniques there?
They describe checking for something called movable dullness. It's a sign of fluid buildup in the abdomen, ascites. The technique involves tapping on the abdomen while the patient's lying on their back, listening for different sounds. A hollow sound called tympany versus a dull sound. Then you have the patient roll onto their side and tap again. If the areas of dullness shift and the tympanic sounds move, that means there's fluid moving around in the abdominal cavity.
So moving on from the purely physical exam, the manual also delves into the various factors that can affect a person's health. What were some of the internal body-related factors they considered?
They emphasize the link between your mental and emotional state and your physical well-being. They recognize that emotions like joy, anger, fear, sadness, they don't usually cause disease directly.
Right.
But they pointed out that prolonged intense emotions can disrupt the body's functions and contribute to illness. However, they also strongly believed in the power of a positive attitude. They linked it to what they called a proletarian worldview and revolutionary optimism. They even cited examples of burn patients who they believed recovered better because of their strong spirit. It's fascinating to see how they intertwined ideology and health.
It really is. And what other individual factors did they take into account?
They said that how your body reacts to its environment and what's going on internally can vary depending on where you live, your age, your sex, and your individual sensitivities. They give examples like children being more susceptible to polio, older adults having a higher risk of cancer, people having allergies to pollen or seafood, and the fact that some illnesses are more common in men or women.
And what about factors outside the individual?
They called those environmental factors. Things like climate, geography, living conditions, work environment. They recognize that these external elements play a big role in the patterns of health and disease within a community.
And finally, in this section on influences, the manual addresses biological factors, which is more in line with our modern understanding of infectious diseases.
Right. It talks about pathogenic microorganisms like viruses, bacteria, fungi, parasites, pointing out that they often have specific targets in the body.
Okay.
Like the bacteria that cause dysentery, they mainly affect the colon, while the encephalitis B virus tends to attack the brain. And they described infectious diseases as having a typical course, an incubation period, a predictable progression, specific changes they cause in the body, the outward signs and symptoms, and often the development of immunity after recovery.
Now, diving into the specific concepts of traditional Chinese medicine, the manual talks about imbalances in yin and yang. How did they explain these imbalances as leading to illness?
Right, they explain that illnesses are often understood as disruptions in the balance between yin and yang within the body.
Oh.
But they stress that these imbalances are complex, their effects can overlap. It's not a simple one-to-one relationship between a symptom and an imbalance. They also said that a single patient might not have all the possible symptoms associated with a particular imbalance. It depends on where the problem is, whether it's more external or internal, and whether it's characterized by cold, heat, deficiency, or excess.
And what about Piao and Li? What do those terms mean in this context?
Piao and Li are key indicators for figuring out where the illness is located,
Okay.
whether it's on the surface or deeper inside, and how far along it is, how serious it might be. Generally, illnesses that are Piao, or external, are seen as being in the early stages, like when you first get chills. And they can be further classified as due to external cold or external heat.
And what about specific types of illnesses, like those characterized by heat or deficiency? What were their characteristics?
Heat illnesses were often attributed to actual heat, to changes in the body that create a state of heat, or an overactive response. Common signs were a flushed face, fever, feeling restless or agitated, constipation, a thick yellowish coating on the tongue, and a rapid, strong pulse. Deficient Su illnesses, on the other hand, were marked by a decline in the body's functions, weakened resistance to illness, fatigue, shortness of breath, poor appetite, weight loss, and a pale, possibly swollen tongue.
So a lot of emphasis on observation, on those external signs. Were there other important terms they defined in this section?
Oh, absolutely. They defined the upper orifices as the eyes, ears, nose, and mouth. The main openings to the outside world in your head.
Right.
Primordial energy, or yuan-qi, was described as this fundamental life force or energy in your body. The Tiantian was located a few inches below your navel, considered a vital energy center.
Got it.
They also linked specific tissues to the 5 viscera, your major internal organs. Blood vessels with the heart, skin with the lungs, sinews, tendons and ligaments with the liver, flesh with the spleen, and bones with the kidney. And then Sunyi, often translated as saliva, was actually defined more broadly. It encompassed all normal bodily fluids like sweat, blood, semen, tears, urine.
Maintaining a balance of these fluids was seen as key for overall harmony.
And were there specific symptom patterns associated with certain imbalances?
Yes, they outlined several common ones. Yang deficiency, Yangsu, was characterized by things like a pale complexion, cold limbs, and a weak pulse. Deficient yin, Yinju, often involved a dark facial color, dry mouth, afternoon fevers, constipation, and a rapid pulse. Deficient spleen, Kisu, was typically linked to digestive issues like indigestion and diarrhea, as well as weight loss and cold extremities. It's important to remember that their understanding of the spleen's function is quite different from the Western medical view.
So this whole framework of traditional Chinese medical concepts, it's really the foundation for how they approach diagnosis and treatment. Now, the manual also talks about the role of the barefoot doctors themselves and the wider use of traditional medicine. What were the key takeaways there?
It really emphasized how widespread the use of Chinese herbs was, not just by the barefoot doctors, but by ordinary workers, farmers, soldiers. They highlighted the successes they had seen in treating common illnesses in rural areas, and the valuable experience they had gained in handling tougher cases. They credited this practical, grassroots experience with contributing to the development of a new medical system in China, one that aimed to blend the best of traditional Chinese and Western medicine. They also noted how abundant medicinal herbs were in Hunan province, making them readily available and valuable.
A real focus on accessible healthcare. So the manual then goes on to describe specific folk treatments. What kind of techniques were included in this category?
This section gets into some simple yet effective treatments that were common in the Hunan region. One of them was skin scraping, or guasha. It was used for things like heat stroke, headaches, indigestion, and pain. The technique involved firmly stroking or scraping the skin, usually on the back, neck, or limbs. They'd use a smooth-edged object like a coin dipped in wine or water, or even just their fingers.
That sounds intense. Any other folk treatments they mentioned?
Another common one was bloodletting, used for heat stroke, colic, vomiting, diarrhea, abscesses, stroke, and injuries from trauma. Basically, they'd clean the skin and make small punctures with a sterilized triangular needle to release a bit of blood. Specific points, like Shusuan on the fingertips and Wachung in the back of the knee, were considered particularly useful for certain conditions. The manual also noted that bloodletting for abscesses and swellings could be followed by cupping to draw out more fluid and help it heal.
Cupping has become a bit more mainstream in the West recently. How did they describe it in the manual?
Right. They described it as a technique using a cup, often bamboo or glass, to create suction on the skin.
Okay.
Traditionally, they'd create this suction by putting a flame inside the cup for a moment, then quickly placing it on the skin.
Wow.
The vacuum would draw the skin and underlying tissues up into the cup. It was seen as a way to enhance bloodletting by draining pus, reducing swelling, and removing toxins. And they used it on its own for things like colds, headaches, and back pain.
And was massage part of their traditional toolkit too?
It was. They had techniques called tuina, which involves pushing and grasping, and amo, which is more about palpating and kneading.
Right.
They saw massage as this straightforward, effective way to treat a bunch of issues. It was believed to help clear blockages in those energy channels or meridians, improve circulation, loosen stiff joints, and boost the body's resistance to disease. Conditions they listed included back pain, rheumatism, paralysis, and digestive problems.
So a lot of emphasis on these hands-on, non-pharmacological approaches. Now let's talk about acupuncture and moxibustion. Those are central to traditional Chinese medicine, of course. How does the manual explain their basic principles and techniques?
For acupuncture, they emphasize carefully choosing a few potent points instead of using a lot of needles. They recommended quick insertion to minimize discomfort, and they said that deeper penetration could be used in some cases, except in areas where vital organs were close to the surface, like the chest, back, and abdomen.
What about the actual handling of the needles?
They described techniques for manipulating the needles after insertion. Different angles, like vertical, slanted, horizontal, depending on the point and the desired effect.
Okay.
They also talked about specific manipulations, lifting and thrusting the needle, rotating it. And they explained how to withdraw the needle properly and apply pressure to prevent bleeding. Importantly, they also described using acupuncture needles for bloodletting at certain points.
And the manual actually gave examples of specific points, the meridians they're on, what they're used for, and how to find them, right?
Yes, it provided tons of information, listing points, their corresponding meridians, the conditions they could treat, and clear instructions on how to locate them using anatomical landmarks. For example, it mentions the Hoku point on the hand for toothaches, Susan Li on the leg for diarrhea, and Taichung on the foot for joint pain. And then there are these tables, 431 through 436, that list a huge number of points all over the body and what they could be used for. Everything from neurological issues to digestion to pain relief.
So what about moxibustion? The practice of burning moxa wool near or on acupuncture points. How did they explain that?
They explain it as a technique where you burn mox wool, usually made from dried mugwort leaves, either directly on the skin over a point or holding it close to generate warmth.
Okay.
It listed specific points like Kuan Yuan below the navel, Qi Hai also in the lower abdomen, and Ming Min in the lower back.
Okay.
And it described their uses for things like strengthening the body's energy, treating digestive problems, and addressing weakness and fatigue.
And didn't it also talk about combining acupuncture with modern medical treatments?
Yes, it briefly mentioned injecting drugs into acupuncture points,
Oh, wow.
giving examples of medications like painkillers, local anesthetics like Rocaine, dextrose solutions, even antibiotics with suggested dosages. It's another example of how they were trying to integrate traditional and Western approaches.
So the final major section of the manual is all about managing specific diseases. It covers a lot, but can you give us a sense of how it approached some specific conditions? Let's start with something as common as a fever.
For fever, they explained the different ways to take someone's temperature, orally, rectally, in the armpit.
Right.
Along with precautions like cleaning the thermometer, it mentioned physical cooling methods like cold compresses and alcohol wipes.
Okay.
They also distinguished between fevers caused by wind chill, like a cold, and wind heat, like the flu, suggesting different herbal remedies for it.